The opinions and statements made by the guests of the Success in Practice podcast are their own, and I do not endorse or accept responsibility for their positions. Any information given by myself or the guests is educational in intention and not to be taken as medical advice. If you choose to act on the content involved in the podcast, you do so at your own risk. Okay, welcome back to another episode of the Success in Practice podcast. Today I'm rejoined for another episode with Bruce Duncan. Bruce has been practicing for over 25 years, probably over 30 years now as an osteopath. Bruce has treated people from all walks of life. He's been an osteopath to the Australian Open tennis tournament since 2004 and at the Hawthorn Football Club since 2015. He has previously lectured at Victoria University and RMIT and taught on many postgraduate courses for osteopaths. Bruce founded North Carlton Osteopathy in 1998 and continues to practice there to this day. Over the years, he has attended many postgraduate courses himself, always looking to learn and develop, which has culminated in a wide variety of treatment and management skills at his disposal. I really personally enjoyed the first episode I did with Bruce. Oddly enough, we don't agree on some things. We do agree on most things, I think. And it was just that dynamic that I had with him where I felt really comfortable kind of putting my point of view, and I really enjoyed the pushback that he gave me because it challenged me to think as well. And that was really the main reason why I invited Bruce back on, because I think I can learn some things from listening to people like Bruce. And so thank you for being that way, Bruce, and thank you for joining me on the on another episode of the podcast.
Oh, thank you very much for inviting me back. I love what you do, and I really appreciate it. And listening to all your fabulous guests that you have on,
Mate,
you're
yeah,
doing a great job.
thank you for that. I know it's Melbourne Cup Day down in, as we record this, we're recording on Melbourne Cup Day in Melbourne. I know that's a public holiday down there, and it's not for us here, but me and Bruce, we had a chat to set up this podcast. We both said that we'd enjoy a glass of wine. So cheers to you, mate.
Cheers.
So yeah, but
Mm.
hopefully you haven't had too many today, Bruce, that we can get you. I'm just wondering who I'm speaking to. If I'm speaking to a diplomat tonight, or
Yeah.
I'm gonna be up for a bit of a boxing match. But we'll see how we
I,
go. I don't mind
I
both.
was I was under strict instructions not to have too many before I started. So
And I'm sure you wouldn't have followed those instructions, but anyway, we'll see how we go. I know we did this, we covered this in the first episode, but let's do this briefly. Give us a little brief background about your history, I guess, into osteopathy and your background and what you like to do, and just tell us a bit about yourself so that the people that haven't listened in the first episode get a chance to catch up on you.
yeah, thanks, Sammy. I was the third year to go through RMIT. It was very much in its infancy, the course then. And I was lucky enough to work for my first job out was with Lel McAllister, who was 76. He was a grandfather sort of osteopath at that time, um, uh, and amazing manipulative skills and lots of soft tissue work. So that was my grounding. I was with him for 5 years. I then opened my own practice in North Carlton, North Carlton, named North Carlton Osteopathy, back in '98, I think. Yes, yeah. Or was it before then? Gee, the years fly by, don't they?
Well,
Yeah,
let's go with 98.
I think it was. Yes, and I've been in that practice for ever since, and grown it a fair bit. There's 7 of us at the moment. Massage therapists, some Pilates classes, and yeah, been lucky enough to be involved in some sporting organisations as well. So
Yeah.
yeah,
All right. Well, there's a couple of things from that that I will kind of bring up, which is interesting to me. But one of the first things I want to, I guess, ask you, and we might go down a couple of rabbit holes here because trying to get some topics together for a second podcast is a little bit more difficult because you kind of want to go a little bit deep diving. But I want to ask you about your time with is it Lyle McAllister?
Lal, yeah,
Lyle.
L.
Sorry.
Well, his full name was Alistair McAllister.
Right, Alistair. So
Yeah,
Lyle McAllister. I want to ask you
yeah,
about, I guess, your relationship with him, and not so much even back then, but even to this day. I know for myself, I'm always quite humbled by the people that taught me. Like, if I ever think that for whatever reason, I think, oh, geez, I did a good job today. I just always just think back of, I don't, I set some people up in front of me that I know it's just very hard to think of yourself as anything but somebody who's always trying to get better. And so, do you feel that with, I guess, the person that mentored you? Do you still have that as with the experience that you've got? Do you still kind of have that feeling of, geez, he was that good, and do you aim up? Does that help you aim up? Do you want to comment on that? I know I feel it. I just wondered if you felt it too.
yeah, absolutely. Yeah, I reflect often about my experience back then, and very appreciative. And unfortunately, I've probably dropped some of the skills that I learned because he had so many varied techniques. And I think I have, yeah, compacted some of my knowledge and techniques from that time. But the fundamentals were amazing in that experience. And it wasn't just him. We had some amazing teachers at university level too. Cynthia Tucker, and we had Ivan Lolomon come down to visit regularly. And uh, Wayne Mahmood, who you've had on your podcast,
Yes, yes, good guy.
um, and John Pitcher. So just some fantastic teachers coming through, and in that early time as well. And
Yeah,
one there was another osteopath, Glenn Bales, who's sort of well known in Melbourne, and he was with us in the same practice. So yeah, it was a great foundation. Forever
yeah,
grateful.
yeah, great. And so last year, I think you said that or earlier this year, you did a talk on traumatic injuries in sport.
Mm.
And so I want to ask you a bit about that. Tell us about that particular presentation that you did. Maybe give us the an overview of that. And I guess before you do that, maybe define what that actually means, because most people would think that all injuries in sport is traumatic, but that's
Yeah.
not always the case. What is? I mean, there's loading injuries. There's injuries that happen over time with specific loading. But what do you mean by traumatic injuries in sport?
Yeah, well, you're spot on. It's as distinct from the loading issues or overuse injuries. The traumatic injuries can and they can be mild or they can be quite severe. And yeah, I was asked by the Fit for Practice group with Tim
Right.
Taylor and Miranda to present because their whole 2 days was on trauma, and so
Hmm.
my brief was doing trauma in sport. And yeah, just put a unique lens to how yeah the different factors of trauma in sport. Um, One thing that's really interesting in my mind is that it's not often that you get to see your patient potentially be injured. So there's sometimes that opportunity if you're working with a team, or you can watch you can be watching on the sidelines, or you can see it on TV. So you actually see or get vision later of the actual injury and the mechanism of injury. And increasingly, elite sporting teams are using that vision, and replaying it, uh, uh, courtside or on the sidelines, to see what actually happened, and whether and that can very much guide where they want to what they want to do with the patient.
Yeah, it does inform diagnosis as well. I mean, it would
Very much,
100%. Yeah.
yeah. So yeah, that's always fascinated me, and then, within that presentation, it's such a broad topic, but I just thought I'd hone down on the simple hamstring strain, and and do a little bit of a deep dive into the classic hamstring strain, and it's the hamstring strains have sort of been reclassified. It was this it's within the rehab world. There's been quite a shift over the last few years, and it was started by the British Athletics, um, Association, and they wrote this seminal paper that's basically informed rehabilitation worldwide. And so they reclassified hamstring strains to be, so traditionally, grades 1 to 4, one
Yeah.
being sort of a 10%, grade 4 being full rupture. But then they were wondering why some hamstring strains, even though they were fairly mild, would sometimes take a lot longer. And so with mostly with the help of MRIs, they would determine that, the musculotendinous junction, or in fact tendon tears, which is classed as C. So there's A, B, and C. So A being muscular, B being musculotendinous, and C being tendinous. It actually end up taking a lot longer. And so,
The tendinous ones take longer.
yeah, yeah,
Okay.
and we can assume that's, not as rich a blood supply, and that, the connective tissue strains are of greater demand. And um, so they then were able to, with further research, determine that, there are basic guidelines between, basic muscular can be between 2 to 4 weeks. Then the next stage is 6 to 8 weeks, and then the next stage is sort of eight, that can be, 2 to 4 months sort of thing. And it gave great clarity into the different strains, and it's basically why all elite teams will, at the slightest hamstring strain, will send them off for an MRI, because it can very much inform prognosis and real rehabilitation. So, yeah, that
Yeah.
pathway.
Okay. I'll have a couple of questions on that. I mean, my personal experience with it is that generally I find that the higher the strain, or the more, I guess, the strain, or I mean, let's call it what it is. It's usually, even if it's a strain, it's usually a tear. There's muscle fibers
Yeah.
that are torn, whether it's at 10% or whether it's at 90 or 100%. But the tear is often, if it's in the muscle belly, the there's usually more fibers that are being torn because the muscle belly is a bigger cross section, versus the tendon that has a smaller cross section. Does that play a role in? I mean, you said that obviously due to the poorer blood supply to the tendon, and the harsher the connective tissue, it's a tougher tissue. Does the actual amount of tissue fiber being torn play any role in the timeline required for rehabilitation?
Yeah, absolutely. So, and that goes towards the initial grades 1 to 4. So one being 10% and 4 being complete rupture. So yeah, within a muscle belly, you can get a, quite a severe tear, and that will take longer. But, uh, regardless, I'm from this paper, they did determine that, of if it was an equal cross-sectional amount of tearing, say if it was a grade 2A versus the grade 2C, then the C would definitely take longer.
Yeah, it's tougher tissue and poorer blood
Yeah,
supply. Yeah.
yeah.
Yeah, right. Okay.
and they can start, we can start rehabbing and getting them moving, you know, early-ish, but it's just ramping up the demands and the speed and the ballistic movement. That's the challenge with that sort of thing.
Yeah, okay. And has there been, due to this reclassification, how long ago that happened, Bruce?
I want to say, I've got a little bit of information on the side here. Just so um, it's it's very much been in the last probably 10 years, I would say.
Oh, so
Yeah.
it's enough time to understand if this has actually improved outcomes.
Oh, very much so.
So
Yeah, they've
there's been
yeah,
follow up studies and seen,
mm,
yeah. So
yeah,
okay,
yeah. And it's
all
been
right.
reproduced in all sorts of different sports as well.
Yeah,
Yeah.
great. Okay, well, that's great information. And so your particular expertise, I guess, and niche is in the application of osteopathy in that particular rehabilitation process. And I
Mm.
guess I wanted to get your unique take on that. And you know, how can the osteopathic mindset, I guess, positively and uniquely influence the healing process of the hamstring injury in I guess specifically, but also just more broadly, traumatic injuries in sport?
Yeah, well, again, I love working, particularly at Hawthorn, and I get to see some of the best uh, rehabilitation specialists and physiotherapists work with the players. In terms of their treatment, it's I would say as I said, their rehabilitation is elite, but in terms of treatment, it's still quite localized, and so I still think our osteopathic lens has a great role to play and bringing in the whole person. And so even just, take again a hamstring strain. We classically will look at mechanics of the ankle and what's happening at the knee and the hip and what's happening at the pelvic mechanics and the lumbar spine. But not only that, we typically look at the other ankle. If there's been an old sprain of the other ankle and there's having the patient potentially favour that and load more on the other side, which could be the precursor to a hamstring strain. So we are just naturally with our lens perfectly looking at and being able to do something about whether it's joint or muscular imbalance, and looking at the whole picture.
Yeah, I guess just to follow up on that, I mean, I did a presentation and a course on the foot and its application to lower limb and lumbar spine injuries, and just a simple, I guess, dorsiflex opposite foot will create semi-flexion at the knee and then create overlocking in the opposite knee, and that
Yeah.
could put an increased eccentric strain on the hamstring. That's just a very basic strain pattern that you can
Mm,
just see on a patient when they walk into your
mm,
clinic. And so that's just to highlight one particular. But you're right, just ankle injuries on opposing ankles and different types of, I guess, mechanical presentations. They will affect those traumatic injuries. What I do want to ask you is that are you having a great influence there on the actual? I'm talking specifically here at Hawthorn. You mentioned earlier that you work alongside some really good rehabilitative specialists and physiotherapists. Are you having an influence on them, Bruce? You said that they're still quite
mm.
local. Are they as appreciative of what you do as I'm sure they are appreciative because you're still there. They've kept you around, so they
Mm.
obviously appreciate what you do. But are you rubbing off? Are they kind of like are you having an influence there?
Well, it's really collaborative. So So at a basic level, there's a whiteboard with my name at the top and with my times posted, and so
Yeah.
players are free to book in with me, or the physiotherapist or the sports doc will put in a play with me, um, and ask me to have a look, and they'll do a little bit of a handover. So yeah, they really appreciate the different lens that I have. Particularly for thoracic dysfunction, rib dysfunction, diaphragm, sort of anterior pelvic structures, psoas, and but yeah, I guess my manipulative skills, they just don't have as much. I do show them, and they want to learn, but um
Yeah, it
yeah,
takes time. It takes time. You
it
know,
does.
you
Yeah.
got to put time and volume and years into that.
Mm.
And I guess, but what I guess more so the question is more centered around the mindset. You know, are you having an influence on the mindset of them? I mean, learning the skill set takes time. Learning the mindset takes time too. But at least are you seeing a willingness to want to kind of understand your position?
Yeah, well, yes, they do appreciate the osteopathic lens in
Yeah,
terms of looking at the whole, and
yeah,
they will specifically sometimes ask me to go, this is what we've done, but
yeah,
we want you to look, beyond where they're
yeah.
feeling their trouble.
Yeah, because I think ultimately also, I mean, as much as they would be quite up to date with the evidence and what you discussed earlier, I guess sprouted from evidence. You're working on the top 1% of athletes, you know, and you're trying to find an edge. And I don't know if that edge is found in the evidence. I think it's found more of a pioneering
Mm.
eyesight. Would you agree with that? And do you find that you're often kind of just using your entire clinical experience that might be outside of evidence? Like I mean, are you doing something and saying something to a physiotherapist there or a sports doctor, and do they often turn around and say to you, "Well, what's the evidence for that?" I don't think that would be happening, but I will ask you the question.
Mm.
Can you comment on
Mm.
that?
Well, that has happened to a one of my associates was placed in an AFL club early on in his career after transitioning from being a massage therapist, and came up against some opposition from the head physiotherapist, and was specifically asked that, like, oh, so what's your clinical rationale for doing that? Uh,
Clinical
and
rationale is one thing, but evidence
yeah,
is another thing. Like that's
yeah.
yeah,
Well, I mean, if yeah, they were happy to. Uh,
I think that's a
Yeah.
fair question. I mean, to ask
Mm.
clinical rationale is a fair
Yeah.
question. That's definitely a
Yeah.
fair question. You have to have
Mm.
some kind of logic and rationale behind what you're doing.
Definitely. Yes.
Evidence, though, I mean, to present, do you understand the evidence? Do you understand the randomized controlled trials, the systematic reviews, all the literature that's underpinning what you're trying to do? It
Yeah.
doesn't seem like that would be a massive part and a massive question that would come to you. So I'm surprised it came to your colleague, but
Mm.
I don't think that would come to you. I think that if you're working as a proper team and there's mutual respect there, I think they would be trying to really get the best out of your skill set. And I think to maybe wrap that with evidence and restrict you with that might not offer them your best. So
I absolutely agree, and I personally have never been asked that, and
yeah,
they're happy with my clinical skills and my clinical judgment to
yeah.
provide care.
Yeah, I think I'm of the opinion that I think the people that are doing that kind of work are generally interested in just the best outcomes,
Mm.
regardless of what's out there or what's not out there. And so it's good to hear that from you, you're in the trenches doing it. In terms of though the question earlier about the osteopathic mindset, and you gave the experience of the hamstring strain. And I guess you apply that across the board with traumatic injuries. How do you then move that alongside quite severe traumatic injuries, like, fractures and, I mean, you're in AFL, there's a lot of
Mm.
busted noses and elbows to the head and, fractures and so forth, especially rib strains, I think are quite predominant. You get elbows and knees to the back of the ribs. How does that work into your particular niche with the club?
Yeah, I guess there's I don't they don't often send me those sort of players to me for treatment. Um, the approach though would be if I was, and I occasionally get to do that, especially if I already have a pre-existing very close relationship with the player that I've treated a lot. I will sort of draw on my sort of indirect skill set in terms of uh, you know creating balance through the, say if it's a lower limb fracture, I might be able to do a fluid drive through that particular tissue or bone and do just a general balancing from an indirect perspective. So that has yeah, that has occasionally happened. I'd like to do more of that. I really enjoy that. Um, but yeah, I'm
Can you give us an overview of your thought process? I mean, if that was opened up to you, I mean,
mm,
from a macro perspective, how would you approach those more severe traumas? I mean, like if you were teaching me as a younger osteopath, and I guess you can't be specific because there's not a specific case in front of you. But
mm.
in terms of your mindset, what are some of the macros that you're interested in?
Well, on a basic level, I want to take the tissue or the whatever structure I'm working on, whether it's a bone or the muscle or the let's take a a tibial fracture. I'll just want to hold either end and just take it into a place of balance and take it into a position of ease and allow say I'm using if I'm working with the fluid model, I'll be just looking for a settling of the waters, if you like. Um, and if I stay in that space for long enough, it will then integrate with the whole. So that's yeah, that's entirely teachable to
Yeah.
you know a new grad.
Yeah.
Um, and it can bring great therapeutic effect, in my
Yeah,
opinion.
yeah, and
Mm,
obviously the flow on effect of blood flow and healing and improvement in healing. I guess regulating blood flow is really inflammatory management is really where it's at in those
yeah,
early stages of acute response,
yeah,
and balancing those tissues is what creates, I think, the best environment for blood supply.
yep,
It's fluid in and fluid out, right? So
mm.
balance is really what Bruce said about balance there. Just is, I think, the perfect place to start. All right, and will you be doing more of that, Bruce, in terms of the traumatic injury stuff? I mean, you said you thinking of presenting that at all to the profession, our profession, or is that something that you? I guess, I mean, you've done that already, fit for practice.
Mm.
Are you looking to expand that anywhere else if people want to catch that?
Yeah. I mean, I get probably 5 or 6 times I've been invited into individual clinics this year just to present, mainly to go through either HVLA or go through indirect BLT type treatment techniques. But yeah, I mean, I enjoy presenting, so yeah, happy to do more of it.
Yeah, awesome. All right, well, we'll keep our ears to the ground for more from you on that. I want to shift over to the I guess your particular clinic, and I'll talk about some of the people that have come through your clinic, and I guess their experience there. How do you go about, I guess, transitioning your graduates, your early career osteopaths, from being graduates to being practitioners.
Mm.
Is there something specific that you feel that is important that you do to kind of get them up to scratch?
Well, I think, first step is choosing the right person that will fit our practice, both from a personality perspective and someone who's potentially done some extras in terms of whether they've. My last two grads have actually worked in clinics, in my friend's clinic, in fact, and has been exposed as reception or just helping out. So, uh, so getting the right person is really important. And then, yeah, I really enjoy the mentoring process, and it's a fairly structured process. It's meeting once a week with them. It's treating them. It's getting them to treat me. It's we also conduct a group professional development uh, couple of hours once a month. But more to your question about how do I mentor the new grads, it's more meeting them where they feel like they need to improve. So whether it's technique, whether it's their communication skills, whether it's their diagnostic skills, I'm sort of happy to meet them where they need to be met. But we will cover all those topics as we go along. Um, and yeah, I'm in it for the long haul with them. So I make it certain that it's not, there's no hurry for this. You'll get better as time goes on, and my door's open too, so they can come and observe and help out as well. And I've also blessed with, I've got Carl Ridgway who's been with me for over 20 years, so he's a and Matt Stacey's been over 10 years. So I've got some really experienced osteopaths in my clinic who love to mentor uh, and guide the newer osteopaths. We also have a common morning tea time. I don't know whether I mentioned it last time, but
Yeah, you did.
uh, yeah. So again, that's a really
Yeah.
nice time to informally discuss little patient management issues or even quickly go through something, whether it's a technique or whatever.
Yeah, well,
So
I think that, I mean, that's how we all did it, right? Like,
mm,
when things were a bit more relaxed and you could just sit there around a table, have a coffee and have a chat about what's going on.
mm.
Bruce, what have you learned about graduates? I mean, what have you particularly learned? I mean, given that you've seen a fair few, what have you learned about them in terms of their strengths, their weaknesses? Have you noticed any trends? What are you seeing?
Yeah, good question. Yeah, without wanting to knock the universities, I would definitely say that uh, some of the graduates aren't as strong as they used to be, and I'd never thought that I needed to when I'm interviewing whether I'll get uh, the prospective osteopaths to actually do some hands-on treatment on me to test them. But now that's a vital component of my interview process.
When you say strong, can you be specific in what areas? Are you talking about technique, diagnostics, the whole picture?
Technique,
Technique.
technique, yeah, yeah. Even just basic, yeah. Like I really rate good soft tissue work, and soft tissue work is with intention, and I think I can pretty much, and I'm sure we all can, but you can really feel when someone's with
Yeah.
present with the tissues, and so I've my last few people that I've interviewed, I could tell immediately just from their doing a little bit of soft tissue work that they had great intention. had the feel, and even from there, I felt that they, if there was techniques that were needed to be improved, that they were very teachable.
Yeah. Look,
Conversely, I've had, I interviewed a few that just, yeah, I thought it'd be a harder road to teach. Mm.
yeah, and it seems like when we talk about these things, we use words like feel and intention, and they can be somewhat abstract.
Mm.
But I think that there was, and you said it that, and again, we're not to bash the unis, but it wasn't like that a while ago, and it isn't getting better. If you had to make a call and be honest about it, it's probably getting a little bit worse. And those words can be quite abstract, but it is something we're seeing and we're all seeing, and it wasn't something that was around a while ago, so it must be something that can be taught. And I think it's probably multifactorial, and I want to have a conversation with you about it. What is it you think that's missing? If it is an education problem, and again, we're not assigning blame to. I don't think anybody at the universities goes to the university and thinks, I'm going to do a piss poor job on these students. I don't think that's what happens. I don't know what happens, and I don't know why there's been a bit of a slippery slope backwards. But let's have a conversation about it. I mean, what is it that you think can be done better, I guess, at the tertiary level to at least not, I mean, you're not going to get everyone through, someone's going to slip through the cracks. But talking yesterday, or not yesterday, a couple of days ago to Tom Barry, talking to many osteopaths of that earlier RMIT vintage, they just said that course was an absolute rigorous, like, testing funnel of, just they were just almost traumatized by it, but they all came out the better for it. And so what is it you think about tertiary education that's created some of these gaps?
Yeah, I mean, in many ways, I don't feel qualified enough to say, because I'm not
Well,
at the coalface of
yeah,
the university.
I
But
know,
what I
you're not
can
there,
say,
but you're seeing the outcome.
yeah, I am.
Yeah.
And what I can say, and what I personally have offered, is that I'll show up. Like I'll be I'll do a free guest, for a few hours, and I would love it. I reckon there'd be enough of us that for once every 3 months, or once a couple of times a year, Sammy gets invited to come and and show. It could be a few of us. Come
Yeah.
and do a workshop.
We had
And
that. You had that.
yeah, well,
Yeah.
exactly. I
Yeah.
literally, as
You
said,
said Ivan would
Ivan
come
came
down and
down,
yep.
and I'm sure he wasn't getting paid. I think he just
No,
came down because
he loved
because he
it.
just loved it, and yeah, I think, yeah. So whether the complexity of the university system allows that for these days, in terms of insurance and timetabling and all that, I have no idea, but. Uh, I would love that to happen, and I
Right.
think it could be inspiring,
Yep.
and we tell tall stories to the students, and it might help inspire them, and yeah, and that was, as you say, that was our experience. So
Well, this is a good segue into the, I guess, the retention problem. But I think also adding to what you said, you're absolutely correct in having some of that extracurricular involvement from very experienced osteopaths who not only can teach really good technique but also inspire with anecdotes and stories and tales from the clinic. In addition to that, though, I mean, you mentioned that going through your particular time, you had, great teachers like Cynthia Tucker and uh, uh, is it Gail
Glenn Bales, but there
Glenn
was John
Bales,
Pitcher, John
John
Pitcher,
Pitcher, right?
yeah.
So not only did you have that, monthly or bi-month or every quarter have someone come down like Ivan and talk to you about something or maybe a different perspective. But you just had that week to week, very
mm,
quality input. I think both of those are important. I don't think you can
mm,
just have having obviously that that extracurricular stuff is fantastic. It's better than nothing. But I think you need to have that quality week to week kind of input as well. This is one of the criticisms I've had of at least one of the universities in Melbourne, that they should be getting the best and brightest to be teaching week in week out. Like yourself, John Pitcher actually offered on the podcast to. He goes, "I'll do it for free. Just I'm happy to go and do it." I think the problem there is that teaching has become an actual profession. We used to get clinicians to teach and support them, but now they want people who are actually qualified in teaching and all the administrative and I guess
mm.
tasks that are involved there. But it's much easier to support an osteopath in becoming a teacher than trying to support a teacher to become an osteopath. And so that's my 2 cents on that. But I think you're
Mm.
right in terms of what's missing. And I just hope that we can influence that as a profession. I think even if we talk about it now on the podcast, I think it needs to also come from more official channels.
Yeah.
And hopefully when all the stakeholders, we get told about stakeholders all the time, when all the stakeholders get together in a room. I know that like when they do the annual conference, last time, they have a round table with Gary Fryer and, people from the boards and the OBA and all that. And that's where it should be said. It should be plainly said that there's something that needs to be done. And it may not be that we go head to head with the universities, because it's probably a battle you're not going to win. The
Mm.
universities have a certain direction they're trying to go into in terms of financing the courses and all that kind of stuff. But it might mean that we as a profession have to have some kind of mechanism. I've talked about internship a couple of times now. It might be something to consider, but we have to have some kind of mechanism to support new graduates so that
Mm.
they come out feeling a bit more confident than what they do now. It just makes everyone's life easier. So
Yeah,
yeah,
well, and a really firing student clinic,
yeah.
with lots of patients and good clinicians that to supervise, and that should be a great learning environment.
Yeah, it should be definitely,
Mm.
definitely. All right. Well, I guess it's a good segue into the retention issues, but I want to hold off on that for a minute because I want to ask you. I guess. I mean, let's talk about that. Let's talk about the retention and why new
Yep.
grads are leaving the profession.
Mm.
Why do you think we're getting such an amount of people that get there, spend a year or two, get a bit disenchanted, and think, you know what, this isn't for me? It wasn't
Mm.
something that I was around when I was going through. It's
Mm.
probably your experience as well. We all loved what we did, and we were all very busy. What's going on there, Bruce? Why do you think not only are we maybe not lacking the skills out of university, but then they get to the actual practice and they spend a year or two and then they've decided to leave? What do you think's happening there?
I think it's such a complex issue. So I think one would be that uh, I think, well, for a start, I think it has always happened. There has been graduates that, and it is happening. It's always happened within osteopathy. It is happening within other professions as well. So it's
Definitely.
happening
Yeah.
within, physiotherapy. Um, so there will always be a percentage that, graduates and realize, well, this isn't for me, and that which is totally fine.
Yeah.
Um, I think there is still a problem of that. If a new grade's first experience in clinic isn't a great one, and there's no standard of supervision or mentorship or um, so if they're not getting a great experience, then that they have to be a pretty strong character to then turf that one and then find another
Mm.
position. It would be often that they think, well, stuff this, it's all like this, and I'm going to try something else. So I think that that first job can be really crucial, um, and um, and it's a hard thing.
Um,
Um, yeah, go on.
Yeah, well, you're right. It's hard to kind of have one experience go wrong and then pick yourself up and go for the next one. That can be done, and it usually is. But then
Mm,
the second and the third experience, if they're no good, it's going to be really hard to dust yourself off and go again. How much of that is us as a profession having to standardize? I mean, a long time ago, I think the quality of hands-on application of technique was at a level that it was hard to not find someone that was at a good level,
yeah.
and so that's obviously dropped off. How much of that is the profession needing to standardize mentorship, and how much of that is also maybe unrealistic expectations from the generation that's coming through? Like generations coming through, they expect a certain income, they expect a certain
Mm,
recognition, and as you said earlier, like it takes time, even the physios that you're trying to influence over at the Hawthorn Club there,
mm,
it takes time for them to build up their skill set. So
mm.
how much of it is us as a profession needing to do better? I think that's a big part of it. And how much is maybe setting proper expectations for graduates?
Hello, everyone. I'd like to take a quick moment to thank everyone for watching and listening to the podcast. If you have received value from this episode, the kindest thing you can do for me is to like, share, follow, and subscribe to the channel on whichever platform that you are listening on. If any of the conversations have resonated with you and you feel that I can help elevate your practice, you can find me at successinpractice.net. That is, the Success in Practice program can be found at successinpractice.net. The Success in Practice program is the signature program that takes a practitioner who may be struggling with retaining patients. They may not be certain about building effective treatment strategies, and they may feel somewhat anxious and doubtful about what they are going to do with a patient, and they are not really accelerating in the real world of private practice. It takes this practitioner and it turns their careers right around to the point where the patients have an effective diagnosis and a real treatment plan that they can take home. Patients are happy to book in multiple sessions with you, and they are confident about your abilities. And more importantly, you now have direction and are confident about your own abilities. The program streamlines how you operate as a practitioner. Guys, you should have been taught this at university, but you weren't. You may have been practicing for the last few years thinking there has to be a better way. There has to be a more effective way of engaging with patients and getting them results. Well, there is. And this is what the program delivers. Go to successinpractice.net and check out the options available to you. See where I can help you easily grow your patient list and finally earn the rewarding income that you deserve. For all the information on how you can reach me personally, check out the show notes. Also in the show notes, you'll find a link to the chat transcripts from these podcasts. These are valuable and a wealth of information. I really hope that you're enjoying the podcast. Guys, leave a comment if there's any questions on this episode. And please, don't forget to like, share, follow, and subscribe to the channel. Now, back to the show.
Yeah, I definitely both. Definitely both. And yeah, but I think sometimes new grads can get a bit of a hard time, and that we think that they've got these high expectations. I mean, they've got cost of living pressures just like we do, and and there's this they've studied for 4 or 5 years, and then still struggling. If they're not earning to enough to pay for their rent and whatnot. So um, I can see why they can be drawn into jobs for working in aged care or something that where they're getting a regular salary, and
Definitely.
um, so I can see the attraction there, and it can be, yeah, it can be. I could see it as a real. They could see it as a real risk. Well, if I building up my patient base, and am I going to be able to, in a year's time or 2 years' time, be earning enough to, you know, pay for my cost of living and all those sort of things. So yeah, it's such a complex question, but yeah, I do think that new grads can sometimes be, uh, we can cast them with that. Yeah.
I understand there's an expectation in terms of pay. I get that bit because, yeah, you have been studying for a while, you've been struggling for a while. I think also that younger people are probably getting out on their own a little bit sooner than what we did. We stayed at home with our parents for a lot longer
Mm,
than what they do. And so the cost of living for them is hitting them a little bit harder. I'm more thinking about the acquisition of skill and also the recognition. I think people don't just see pay as pay; they see pay as recognition.
mm,
And so, in the absence of the pay, they see it as not being recognised. That's a hard one because our particular profession requires that you put in the time and effort and the hours and the volume and have patience under your belt. And so that's a
mm,
hard one to juggle. You can't just
mm,
give somebody experience. And
mm.
then, you can't just give, you can't just give somebody a title. But,
Yes,
but, but, we'll,
absolutely.
but we'll get to that.
Well, yeah, indeed. You have to work for that title,
Yeah,
though.
that's right. You got to work for that title. And so yeah, I feel that it's definitely something we need to talk about as a profession. There has to be a standard of mentoring. Um, you know,
I think,
uh,
I think maybe, and I think again, if we could get into the universities and tell our stories,
yeah,
and say what an amazing experience is to develop a patient base that's like family, that
yeah.
you get to care and nurture for over years and years, and it just brings great, well, it's kept me going for, over 30 years, just that,
Mm,
those connections of family, and seeing the journey of patients, from when they were teenagers till their mums and dads,
mm.
and it's a real privilege, and
There's a lot of
so
there's a lot of joy in that. There's a lot of joy in that. I was going to say.
a lot of joy, and so maybe they don't hear those stories enough.
Yeah, no, they
Maybe they're
do.
not getting. So and maybe that there's a mechanism through Osteopathy Australia that we can
Mm,
actually make real stories about, the success of, and not just the success of,
mm,
working with elite teams or anything like that, but just
mm.
the success of your average family practice.
Yeah, no,
It can
definitely.
be, it can be an amazingly fulfilling career.
Well, that's one of the reasons why I enjoy doing this podcast is to talk to people like you, and then hopefully hear some of those stories. So, do you have one for us, Bruce? Do you have something? And I'm at the clinic and I'm thinking of some things that I can ask, the people that I have on the podcast, and I thought, what's the funniest thing that's happened to you in the last week in the clinic, or what's the funniest thing in the last year, or what's something that you can remember that was really that made you laugh? Is there anything that you can remember, Bruce, that just made you laugh in the clinic? Like, is there something that you can share with everybody?
Or put me on the spot. I'm so not good at jokes and thinking of
Well,
funny
not jokes, but
stories.
it's just something, like,
Yeah, I
look,
know, I know.
patients fart
Yeah,
all the time, you got all that
yeah,
stuff,
yeah, yeah.
Uh,
No, you were about. I was hoping you were about to ask me about a joyful
well,
time
I'll get to that.
through
Well,
my practice career.
yeah,
Like
I will get to
I've
that.
got an example.
Yeah,
I've
okay,
got an
go for
example.
it. Go for it.
Well, one of my first ever patients, in fact, I set up a little, when I was working for McAllister. He was just Monday to Friday, 9 to 5. Where we'll wore my little white tunic, and it was hilarious. Anyway, but Saturday morning, so I was still living at mum and dad's. I set up a room there where I treat some clients, And so one of my first ever patients was a gentleman named John Allen who loved his exercise, and went to the gym that I had a connection to. Uh, he was head of English at Camberwell Grammar, and um, and a mad exerciser, and he eventually got into triathlons. Anyway, fast forward to uh, last week, he, as an 80-year-old, he competed in the World Championships in Wollongong, got second in the 80 to
Wow.
84 age group. He has previously, a couple of years ago, won. He won in Spain in the 75 to 79 age group. So I've basically treated him every few weeks for 30 something years, and
Wow.
we've become friends. And he, credits me with keeping him together, but he's just a machine. Literally exercises every day,
Wow.
and so yeah, he's not he's so he brings great joy.
That's amazing, mate. And I
Mm.
mean, I'd love to see that age group, like
Yeah,
line up at the front, at
yeah,
the start
it's
line.
yeah,
That,
it's hilarious.
that would be pretty funny because,
Yeah.
the thing is about, especially men in that age group, is they have an era of sports clothes that fit them really well. And then what
Mm.
they do is they think they get stuck in that era.
Yes.
So if you ever want to see what people in the 60s and 70s wore when they ran, you just go watch an over 75s marathon runner, and you'll get to see what they wore 50 years
Yeah.
ago. Mate, I had a funny story when I was a student with John. I mean, I used to do some prep work for John, doing all the soft tissue work and so forth. And this was like maybe a couple of months into working with John, and we had this little room down at the end of the clinic, and I was in with a patient, and I'd never seen this patient before, and I thought I'd knock on John's door and say, look, I know the notes say something, but can you give me some guidance on what to do? And he's like, yeah, look, make sure you got to release his glutes. You got to really work on his glutes. And John had his, Sami, you got to work on his glutes. You got to release his glutes. So all right. So little did I know, I can't remember his last name. Is Barry, and Barry was very hard of hearing, and he had flatulence. Right. So John set me up, and I've gone in there, and I've put my elbow into his glutes, my forearm into his glutes, and did a bit of kneading, and started to and then Barry's just starting to let him rip, mate, and he's after the first one you kind of go all right, the second one, and by the third and fourth one you go, Barry, mate, and he couldn't feel anything, and he couldn't hear anything, and I'm sure he could probably smell it, but he couldn't care. And so I thought, oh shit, this is like 5 minutes into treatment, and I've got probably another 20 minutes to go. And so I thought, what am I going to do here? So Barry's letting them off every minute or so, and I thought, all right, well, if he's going to do it, I'm just going to join him, right? so we get going, we get rolling along, and then John used to just walk in. He'd open the door and he'd walk in, and as soon as he'd opened the door and walked in, it was just like a Hiroshima cloud of mixed flatulence just hit him in the face.
Wow.
He lost it anyway, and he's like, "What was that?" I said, "Mate, you set me up, so you got some back at you." Anyway, that's
Glad
that's a
you didn't
funny
want to light
story.
a match either.
Mate, it was. If you, I run that clinic now, and that room, if you see it, it's just a small room. Like you could just fit a table there. It wouldn't even have a small. We had a really tiny desk in the corner, so you could barely walk around. That's how tiny it was. So you didn't need a lot to fill it up. It was just, that was a funny story. But
I do. I have thought of one.
yes,
So I did when I studied. It was 4.5 years, and I did 6 months field work, and I actually came up to New South Wales. I might have told you this.
you mentioned that. Yes,
Yeah.
remind me who you
So
work with.
Tom Samuels.
Oh wow, yes, Tom over in Parramatta.
Yes.
In the clinic that I ended up in the same building that I ended up taking over many years later. Wow, amazing.
Yeah.
Yeah,
Yeah.
on Grove Street.
Yeah.
Yeah,
So Tom had this particular table where
I've seen it. Yeah,
the back half would he could
tilt it.
position. Yeah, tilt. He could side bend. He could rotate. So
Yeah,
he'd sort of position the back end to sort of uh, 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 position a sacral torsion.
yeah. He'd do
You
all
know,
these sacral torsions on it.
yeah, and
Yeah,
he'd do a heap of soft tissue work, and he'd tell his stories.
had
Yeah,
his bow
lovely guy.
tie. Had his bow
Yeah.
tie on. Yeah,
Well, so this day he was quite animated with telling a story, and he positioned his client in quite a good side bend and rotation and bit of flexion. It was quite across to the side, and he's doing his soft tissue work through the lumbars and thoracics and anyway he must have knocked the lever that released the spring to bring it back to neutral,
yeah,
and it just slammed back to neutral, and the patient let out a blood curdling scream,
yeah,
and Tom, bless him, he sort of just did a little bit of shaking. He goes, "Yeah, that's
yeah.
better."
That's better now.
It was the best. It
Yeah,
was
that Tom is a character. He's still around. Tom. I spoke to him on the phone maybe a couple of months ago, so he's still around.
great.
I'm trying to get him on for a show.
Practicing? Is he?
Very not a lot. I
Yeah,
mean, I think just
yeah.
close friends and people that have probably been with him for 50 years.
Mm.
Ivan told us a story once where he was doing a cranial treatment on somebody, and he fell asleep, and he just
Yeah,
headbutted them as he
yeah,
was.
absolutely. Yes, for sure.
And then
Yeah,
he goes, and oh yeah, that's better now.
yeah.
Just
There you go. That's
oh yeah,
better.
there you go. That's good.
Yeah.
But
And
look,
the
yeah,
other people I worked with were James and Kerry Harrison in
yes,
Windsor, who were just wonderful
yeah,
mentors and people. Yeah.
good people, yeah,
Mm.
mate. There, so yeah, look, that's they're some of the joyful things. They're the memories that you build. They're the relationships you have, and as much as we get drummed into us about all the kind of the barriers we need to keep between us and our patients. Ultimately, they're connections that you build. You see people on the street; they know who you are. They talk about you. They kind of lift you up, and it's obviously you don't want to let that inflate you too much, but it's hard not to have that kind of love for that, like
Mm.
that joy is
Mm.
probably a better word for it.
Yeah. Yeah.
And so yeah, anyone who's listening who's been practicing in their early stages of their career, even if you go out and observe people who are been practicing for longer and just ask them about all this stuff, that's probably the stuff that you need to hear.
Mm.
But yeah, thanks for sharing that, mate. So I want to then ask you now to let's shift over to I guess the advanced practice conversation that we had on the last episode that we kind of touched on but didn't really discuss in too much depth. But let's
Yeah.
go a little bit deeper today. But before we do that, tell me about the genesis of that, because you were there from the beginning.
Yeah.
Tell us about how that all started, and what the thought process was behind it, and then how it started and how it developed.
Yeah. I actually came in a little bit later, so the committee had already been formed. Yeah. So
Who came up with the
Jason's.
idea, Bruce? Who came up with the idea?
Well, I know Jason Stone, who's a really great osteopath out Wanturnaway down here in Melbourne. Very much involved in the local sports scene. Uh, he was uh, he was on uh, the equivalent of Osteopathy Australia board or committee at that time, or the Victorian branch. And I know part of the thinking was that, well, Australians love sport. Um, we need to get some osteopaths involved in sport, and we might might read about them in the papers and get our a natural way of advertising.
Yeah.
So that was part of it. The other part of it was that other allied health professions have a similar uh, process and ability to get advanced credentialing. So I think, and it can be, it's something for an osteopath to be aspirational about. To have if you got a clinical interest, then you can study further and get recognition for that. So I think they were the three main things about what sparked it off. And yeah, we went through several years on the committee of honing down the criteria, and came up with the tertiary pathway and the vocational pathway. And yeah, and then it came to be. Yeah, a few little teething issues, um, and whilst we were on the sports committee, there was obviously the pediatrics and occupational health and safety and rehabilitation, and I'm missing one. I think, yeah,
Pain.
pain. Yep,
Yeah.
pain
Okay.
credentialing.
So initially, this was thought of more as a sports initially.
Uh,
Was
No,
it?
I
No.
can't confirm that. No,
Right. Okay.
this might have been happening at the
Okay.
same time. Yeah,
All
we were
right.
just I was just
Okay.
on the committee for the sports credentialing.
Okay. So what? I guess then it sounds like that this was a profession-driven initiative, as in like it didn't come from people within Osteopathy Australia who were employees there who thought this would be a great idea. It came from osteopaths who then took it to Osteopathy Australia. And would that be correct, Bruce?
Well,
Or you
I
don't know?
can't confirm,
Right.
but
Okay.
I think that is right. I think
Okay.
that is right.
All right. And how much support did you initially? How much support was there for that? Was it like, hey, this is fantastic. This is exactly what we need, or was it like, look, this isn't on our radar at the moment.
Mm.
If you want to do it, you do it on your own, and I guess we'll be there, but we're not. It's not our main objective. What was the I guess appetite for it at the time?
No, Osteopathy Australia were very supportive, and Peter Lally at the time was the policy officer who basically uh, kept the show on the road. He was instrumental in starting creating the meetings, writing up the policies, the minutes from our meetings, and really crunching down on the 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 do's and don'ts. And yeah, so yeah, very much credit to Peter, um, in that space. Um, yeah, I'd have to say that once it was established, um, yeah, I don't know about the other fields. I can't speak on behalf of pediatrics or any of the other fields, but within sports, um, I, the few of us that got credentialing felt that, you know, uh, recognizing that Osteopathy Australia does have so many balls in the air, but the advanced practice pathway wasn't pushed, and that a group of us sort of got together and sort of off our own bat sort of offered our services again, and to get the ball rolling again.
Right. Okay. So it was
Um,
it was it was it was driven by osteopaths, really. I mean, Peter Lally obviously helped and organised and gave you the organisational, I guess, support. But you guys were doing And not just you, I'm just talking about, as part of the sports, but there were other people on other
Yeah.
committees. They were really driving the process of getting this thing up and running. Would that be
Yeah.
accurate?
Yeah. Yeah. I think yes, but I think Osteopathy Australia, to their credit, they do come. Yeah, they do. They do
Oh,
devote
yeah.
some time to it, but
Okay.
yeah, it's yeah, I wouldn't necessarily say it's top of their list of priorities.
Right.
That's for sure.
Okay. Well, it seems like they're quite on board with it now. Now that things
Yeah.
are kind of rolling, and so I guess that's good. What do you see as being some of the advantages of having the title in place? Like,
Mm.
why would I as an osteopath want to have an advanced title? What benefits does it give me at the moment?
Well, as an individual, yeah, I mean, you can clearly use it to your own advantage in terms of marketing, recognition, uh, yeah, advertising to your own patient base. You can take it to in terms of if I talk on the sports in the terms of the sports field, you can approach. It gives you extra credentials, extra
Qualifications.
cachet. Yeah, extra cachet in terms of approaching sporting clubs. Um, so when I got it, I'd already got my job at Hawthorn. But they were really pleased that I'd gone to the trouble of getting it, and they asked me for the proper certification of my credentialing, and I dare say it's been one of the things that's helped me keep my position there. That I do have that credentialing. Um, I think what else it does as an individual, it provides an opportunity to formally liaise with fellow practitioners. So we've now got a WhatsApp group that we bounce ideas off, and that we might talk about different events that's coming up or who's available. Um, but I think there's it's not just what's in it for the individual, but it's what we can do. If once we get a big enough group together in order to provide quality CPD for the whole profession, or it might be that we can then be at the table with other, you know, with the say Sports Medicine Australia. It might be that we can, lobby different other professional organisations outside osteopathy. So I think as a group, um, there can be strength with that. Um, it can also, looking at the broader picture, I think it can be one of those things that can be aspirational for younger osteopaths. So whether it be students or whether it be new grads, that there is something to progress to, because sometimes there isn't an obvious progression in our profession, that you can just become you know
An osteopath.
better osteopath. But if you've got a special interest, then there's something for you to then to get recognition for, to get um and get a piece of paper
Yeah.
about that you've got that recognition. So yeah, I think it potentially could help us keep new grads if they can see, well, that there is that pathway. That's you know that can only I can't see much negativity around it.
Yeah. Look, a little while ago when it first came out, I was quite I wasn't in favour of the program, and
Mm,
I remember you reaching out and having a chat to me about it. We had a chat on the phone, and I guess I spoke to you about my concerns.
mm,
one of the things that still concerns me is that I think the membership at Osteopathy Australia, you have to be a member first and foremost to have an advanced practice title. And so I think the uptake of membership is about 55 or 60% at the moment of the profession.
Yeah.
That leaves out a massive chunk of osteopaths. A large part of those osteopaths who have since left the association, or Osteopathy Australia, and this is not a critique on the association. It's just it's a natural phenomena that as a practitioner ages, they probably need the association less and less. I mean, a lot of practitioners like to give back and continue giving back, but there's many people out there who would probably qualify for advanced practice from the vocational pathway that are not part of the association. I guess how do you reconcile having such a large chunk of the association or of the profession who aren't part of the association? How do we give them access to that kind of titling? This is something that I've been thinking about recently. I mean, I've got some other critiques of it, but that's something I've been thinking about recently. Do you have any comment on that?
Oh, mate, I'm very strong. I think it's an actual great shame that they're not members of Osteopathy Australia. And you can disagree with the odd thing that they do, but the fact that they lobby and they do so many things that is so valuable for the whole profession is just, it blows my mind that and I hear the odd story that, oh, I rang up and they didn't have a good answer for this, so I quit. Or, or I didn't like the approach that I had for that, so I stopped paying. It's absolute rubbish. Absolute rubbish.
Yeah.
Like, that it's and for I understand the affordability aspect, and that's for new grades. I get that, you know, and
I agree with you there.
I would hope that something could be done with that, but there's no excuse for practitioners that are well established and earning a good living on the back of all the things that we've achieved as a profession, going back in history.
Yeah.
And so to not support that is, grinds my gears, mate. And so if advanced practice, if it actually gets a few people rejoining Osteopathy Australia, fantastic.
Yeah, if advanced practice gets people rejoining the profession, that's a good thing, because I think those people would probably be highly qualified for advanced practice via the vocational pathway. I'd probably disagree with you on the point that you made about practitioners who, yes, there would be some practitioners who probably just didn't get something done that they wanted to get done. But I mean, obviously having a podcast and doing this, for some reason people reach out to me thinking that I'm on 60 Minutes or something, they want to, and so there have been some members that have, long-standing members, people I know specifically, people who were there at the beginning of the association being formed, with Ivan Lullerman and with Wael Mahmoud and those people that have been there, that feel like that the association doesn't represent them, and they're not people that can't afford membership, and they're not unsuccessful as osteopaths, but they have a philosophical disagreement with the direction that Osteopathy Australia decided to go into. I had a chat to an osteopath 3 days ago who is quite, and I won't mention any names, but he's an older osteopath who has lots of experience in the corporate world and feels like that that Osteopathy Australia hasn't provided value for him in terms of advocacy, and he doesn't see that we've increased many of our rights since I guess going out on our own and and splitting up from the chiros. In terms of Medicare and imaging rights and so forth. And so people have different opinions on that, Bruce. And I guess every person is entitled to their own experience, at the very least. And for whatever reason, your point of view is correct. My point of view, from, I guess, speaking to people who have been there for a long time and have been disengaged, is also correct. I think that both of them can be correct at the same time. But that doesn't really matter. What matters is that at the moment, the professional uptake is at about 55 or 60%, and we're missing a large chunk of quite experienced osteopaths. And I mean, they're people like you and me. We need to re-engage with those people and bring them back in. I mean, advanced practice might be one of the ways of doing it. But I mean,
I
the
don't think it's
question.
a big way. I don't think
No, no, I
that's going to
agree
be
with
a
you.
significant way of
Yeah,
bringing people back in. I
no.
think, I mean, part of the issue is Osteopathy Australia, is actually communicating with the membership about all the things that they do, and I think, and that can be, the people don't read their emails as well. Like we get so much information that we just don't have time to read. But yeah, I think I still maintain that they
It's
do many more things in terms of, particularly in the advocacy space, than what we realise that's going on.
in principle, I agree with you that it's better to be part of an association than not, right? And that's why I'm still part of the association, even though I've had pretty public disagreements with with Osteopathy
Mm,
Australia. And so I'm still part of the association because I always feel that the association belongs to us. It belongs it belongs to osteopaths. It doesn't belong to anyone else that might come in or out of employment there. And so, in saying that, I'm going to be around as an osteopath for the next however long I get to live. And so that's a long game for me, and I want a strong association.
mm.
But I
Well,
haven't.
so on
Yeah.
that, um, credit to you that for instance, you're interviewing the board, the board prospects. I think that's a great service, and yeah, I'm aware of some of your history in that space,
Yep.
and the fact that that you're still a member, and B, that you're involved in your own way with I really credit that to you. Um, what I can tell you though, and you were going to ask me this eventually anyway, but from the recent town hall, Osteopathy Australia, and that got in external consultants previously to help guide them, and really good names, but it just, some of them haven't quite hit the mark. They thought outside the square, and they got a consultant in who hadn't worked in the sort of the health space before, and I was really blown away by the presentation and the timeline, and the scope of actionable items that was gleaned by this consultant's process. And it seems that, basically, yeah, and I'm not qualified to talk on it, but you know each person within their osteopathic journey was well represented, from the student level to new graduate to established practitioner to practitioners transitioning out and wanting to retire. So everyone had been looked like they'd been thought of, and osteopaths that were into research, osteopaths that were, and there were very thoughtful uh, items that were needed to be actioned with with varying degrees of urgency based on that consultation process. As I said, I was really impressed. So I hope that a lot comes of that, and
Yep.
I wish more people had have seen it. To be honest, like
Yeah.
you know,
Yeah. No.
but
Look. I don't. Yeah. Again, I don't. I don't. I don't. I'm not saying that nothing goes on over there. That's definitely not what I'm saying. I want to go back to. I don't want to leave advanced practice for a minute. I guess,
yeah,
but while we're here, Look. I'm going off a lot of the conversations I'm having with people, and I always thought that it's good to get external consultation because I think it's better to get people that do something and get them to do it well. But I also think we have a lot of very smart people within osteopathy that people that have run great businesses, people that have consulted with bigger companies than Osteopathy Australia. One of the things that I'm still talking about is just a policy statement or a position statement on who we are and what we do. I still haven't seen that, and that's something as basic. I mean, I don't think you can have a marketing strategy or a branding strategy or anything like that until you actually define who it is that you are, what it is that you do, and I know there is the what is osteo, that website, what is osteo, and I guess that's more for the public. But we don't have. I mean, when we do Osteopathy Awareness Week and we want to talk to the media, and osteopaths are talking to the media, we need to have, I guess, a consistent message about who we are and what we do. And we've never really sat down and discussed it and had some kind of position on it. And as an association, and you might not agree with their position. I mean, the association might get together and have a position, and then you might not agree with that, but that's fine. At least there's a position, and then we, we can debate that position and come to an agreement on it. So that's just one little thing, and I think.
can I comment on that?
Yeah, definitely.
I think that's crazy. Like we're a broad church, Sammy.
Yep.
You think that we're going to get agreement on what osteopathy is amongst the various
Yeah.
factions, or right?
Yeah.
So
Yeah. Yeah.
if so, let's play this out. Let's come to a statement.
Okay.
Like
A
a
position.
position statement,
Yep.
right? You're just going to friggin' alienate a whole group that doesn't agree with that statement. It's
Yeah.
crazy,
I
right?
don't. I don't think so. I think that especially the more I talk to people, the more we kind of get to the same place. Although we have different ways of doing it. I mean, you could be look. You're from what I understand, you teach direct techniques and you teach indirect techniques. You practice using direct and indirect techniques. So it's not like there's a direct and an indirect osteopathy, right? I mean, I'm not saying we should say that this is how we treat and this is gospel. And I guess what we need to do is have a position that unifies people, not kind of breaks people up. We can definitely agree on the principles of osteopathy.
Yeah.
I asked this to all the most of them I've asked that's been on the show, and I think I asked you the same question. What is an osteopath? And surprisingly, everyone always comes back to the principles. Everyone always comes back to, we follow this kind of philosophy. And so we can at least agree on that and then extrapolate how that philosophy can affect, I guess, what we're capable of, our scope of practice in Australia. I mean, our scope of practice is different than what the Americans do. We're regulated, and I think the British aren't regulated at the moment. I don't know what's happened over there in the UK. But we should be able to definitely get a position on how we think and not so much what we do, like as in the day-to-day technique of what we do. So I don't know. If that's what you mean, I would disagree with that. But if you're talking about obviously technique-based stuff, yeah, there's a whole different wide-ranging churches. But this is why this wouldn't be a 1 week process. This would probably take us months, if not years, to come to. But until we get it done, we're going to find it hard to really have some kind of brand some kind of strategy and some kind of marketing aspect to what we do. That's my belief on that. So, but I'm going to let you talk for a little bit, and I guess push back if you want to push back on that.
Yeah, I still with
I mean, do you understand what I'm trying to say in terms of the position? I'm not talking about a position statement on, an osteopath uses HVLA and XYZ. It's more so, this is what osteopathy is. This is the system of osteopathy. We look at the body as a whole unit. We believe that the body has a capacity for self-regulation and healing, and then we actually act out that in our practice. We have multiple ways of acting that out, and each practitioner has their own ways of doing it. That is that we share across different professions. Like chiropractors manipulate, and my therapists are doing cranial now. And
I
so
I think that's fine. I think,
yeah, it's
but
fine. There's
I
nothing
think
wrong with it.
yeah, but I think that's already there. I think that's already there,
Well,
and that we already use that information. But on the on the Osteopathy Australia website, I've seen videos of a consultation process where it's taken, it talked about the philosophy, and we do the take a history and do an exam and do a range of techniques. I think it's there.
yeah, look, I think if we have it where we actually get people involved in it, we get the profession involved in it, I think it's going to bring in people that maybe felt like that, we moved away from that. I mean, we're seeing it in education. This is the thing we talked about earlier, Bruce. We're seeing it in education, and you agreed earlier that if we had to make a call on it, that things aren't going, forwards. That if anything, they're probably going backwards a little bit. And I guess if the association had a stance on what an osteopath actually is, we can then relate that to the universities and say, hey, we need this kind of outcome. When an osteopath graduates, they need to have this kind of outcome. I mean, that might help. So if we don't have it as a profession, it's going to be hard to then communicate that to the education institutions. I know it might be in dribs and drabs there, like it might be on a video here and I guess a blog there, but we need it to be kind of like a constitution for what we do. I just don't think it's that formal, and maybe you believe that it doesn't need to be formal.
I think it's self-evident. Like it's just
Yeah,
it's
well,
what
to me and you it is. To me and you it is, but maybe to an osteopath that's graduating, it may not be self-evident, and to the wider public, it may not be self-evident too. It's funny because you've probably had this same experience as when you do talk to a patient about the osteopathic thought process, they agree with you. The patients who know nothing about anatomy, who know nothing about physiology, they go, you know what, that makes sense, Sami. Like, yeah, that makes sense. Like they get it. And so I think we can use that. I think that's powerful. And
Yeah,
so,
well, I mean, Gary Fry was very strong at the town hall, saying, I think someone pushed back a little bit about around the education process, and he assured us that students are getting the fundamentals, the fundamentals of uh, osteopathic philosophy, the fundamentals of the Greenman screening exam, the fundamentals of a typical treatment sequence, and yeah, so uh for some students, and I remember one said it on your podcast, said that they didn't get that. Well, that's frankly not true.
well, that might be
Well,
their fault. Like that might be. And I had this same conversation with Gary off camera. I mean, not whilst we were recording, but just at a conference in Sydney. And he said to me, he said, look, the green book's there. The red book, the foundations of osteopathic medicine is there. Like we could put it there, but they have to go searching for it. And I agree with Gary. I totally agree with Gary. I think there has to be a impetus on a student to go searching for osteopathy. It's not just handed to you on a silver platter. And so definitely that is there, and I'm glad that that's being offered. I definitely know that as a result, I guess, of my conversation on the first podcast with Gary, that he took some steps to reinvigorate that within Victoria University. And I congratulate Gary and I commend him for it. And I think Gary's one of the good guys in osteopathy. And so I hope that that's permeating through and we see some of the results of that. And so, yeah, I'm glad that happened at the town hall and I'm glad Gary pushed back on that. So that's good if that's happening. But again, that's kind of, we're lucky that we have somebody like Gary at Victoria University. But again, this should come from the profession, and if the profession is on board, at least there's checks and balances there, right? Like, the next person that comes in after Gary may just be a osteopath by name and a PhD by operation. Like, he just might not believe in what we do. And so at least you've got the checks and balances of an association that could sit in a room with him and say, look, this is the kind of student we need. Like, do you know what I mean by the checks and balances there? So that's my position on that. I don't think it's out of reach. I don't think it should cause as much disunity as you might think it would. But that's just my belief. But we don't have to agree on that. Unless there's something else you want to talk to about that, I want to just go back to the advanced practice and talk to you more about that. Yeah. And so I guess my particular criticism, and to give context around this, I'm not under no illusion that advanced practice is going to go away. I think it's here to stay. It seems like the profession has taken to it and is happy with it, and so that's fine. That's okay. Not that I would want it to go away. It's just that I think there needs to be some more thought, I guess, about who qualifies and who doesn't. I think if we take care of that now, we will be in a better place, and it lifts the standard for everybody else. I think you mentioned that there's some kind of talk now for a minimum amount of years of experience. Can you elaborate on that, Bruce, and tell us what's happening with that, or if something is happening with that?
Yeah, I think uh, the original intention and what we set up was that to obtain advanced practice, you would need to have a minimum 5 years of general practice. Um, and I don't know where that got lost along the way, but that hasn't been the case. But I believe, without speaking out of turn, that will be reinstated
Okay.
as it should be.
Yeah.
And yeah, I mean, we fundamentally want advanced practice osteopaths to be excellent osteopaths to start with, right?
You
And
think 5 years is long enough, Bruce?
um,
Like, really? I mean, when we're talking about advanced, let's take the area of sports osteopathy that you've got the title in.
yep,
I've been in that field for my entire career as well,
yep,
and so it's something we can discuss. Mate, I didn't really, I mean, hit my straps until like the 10-year mark. In terms of seeing enough volume, having a general practice, and then having athletes from all walks of life. And when we say athletes, we're not just talking about top flight professionals. But, weekend warriors are athletes as well, not
yep,
good ones, but they're still running around and getting hamstring injuries and quad tears and ankle sprains and things that are related to their sport. And they're just as keen as getting back to sport as what I guess a semi-professional or a professional might be. And so that takes time, for you to see those types of injuries. You would be seeing, I guess, maybe a few a week to start with. If you're busy, you might then go on to be seeing maybe 10 or 12 cases a week. It would take you a bit of time where your books are really full with
Yeah.
with athletic injury, for you to then get enough database in your head to kind of go, yeah, I feel like I'm quite advanced now. I
Well,
personally think there's at least 10 years there, but what do you
yeah.
think?
I'm happy with 5 years for a few reasons. 5 years brings us into alignment with the other allied professions. So that's the standard minimum. I think after 5 years as a general osteopath, you can be a very good osteopath. Like you've got, you know, just and a comeback that we need our advanced practitioners to be very good osteopaths, and I believe that can be achieved within 5 years. Um, Now, you bring up the question of, well, are you seeing enough sports people within that time frame? No, we're talking about people in addition to their general practice. They are doing extra work, extra study, extra work with a sporting team outside of their practice. So they're getting potentially a fast tracked exposure to the sporting athlete, to athletes basically. So if and it probably won't be the case that people will get qualified after at that 5 year mark. That I don't think that has ever happened, but it can be done. That you can be an excellent osteopath and you can get enough exposure through doing extras, through doing study, and through working with sporting teams, and there would be some osteopaths that have been working with sporting teams even as a student, so they're getting exposure to injuries and management of rehab, um, even before they're fully qualified. So I'm entirely comfortable with that 5 year mark. And the problem with making it 10 year mark is that's just. I mean, you think of it, if we want to make that aspirational for students and for new grads, that's that's way too far. Like that's just that a new grad ain't going to be thinking of, oh, maybe if I hang around for 10 years, I can be an advanced practitioner. Like I don't think that's realistic.
But they shouldn't be thinking that, though. They shouldn't be thinking, as a new grad, they shouldn't be thinking, geez, I want to hang around for five
We
years.
we want to be keeping. We want to do everything we can to keep people in the profession, and we make to create opportunities for them to upskill themselves, stay in the profession, not be tempted to go into friggin' wherever else, into
Oh, say
selling,
it.
s-
Come on,
selling. Yeah.
take a jab at another profession. Go on, Bruce.
Mm.
Selling mattresses.
Selling new hips,
Yeah,
or
yeah, yeah,
right.
yeah. Right.
Well, I want to
Um,
keep them.
yeah, I know.
Yes.
I know, but you
So
also you also want that. You want that. I mean, you talked about it being aspirational. I mean, you're there with over 20, 25 years experience, and you've got the title. You might have another how many ever practitioners that are there, and they're all of a certain caliber. And I guess you want to be in that caliber. I mean, once you hand it out to people that have been there for 5 years and then have worked with a couple of sports clubs. I don't know if that's a difficult. I don't know if it's difficult enough. When I say difficult, I'm not trying to say that it has to be hard, but it has to be, I guess, something that to aspire to something. It needs to have some meaning to it. It needs to mean something, and I guess that's what I'm aiming for. That you make it such that it's not everybody can get it.
Hello everyone, just a quick break to give you some information on where to best find me. The first place is the private Facebook group called the Successful Practitioner Pathway. I've set up this private group as a place where practitioners can go and get tips and advice on how to best accelerate their practice and improve their clinical practice skills. The second place to find me is at successinpractice.net. That is where the Success in Practice signature program is housed. You can find more information about me and how I can best help you achieve success in your practice. So, the two best places, the private Facebook group, the Successful Practitioner Pathway, and successinpractice.net. I will link to both those places in the show notes, so for more information, please see the show notes. Now, enjoy, and back to the show.
Yeah, it is, and it is hard to get. We have to strike the balance between making it hard and making it and therefore meaningful, but also not being ridiculously unattainable. So it
Yeah.
needs it is a hard process. You know, you need 120 hours of extra sports related. If you're doing the vocational pathway, you need 120 hours of sports specific CPD on top of on top of your studies that you've already done. You need to write up 3 case studies to that you've been involved in a real environment. You need practitioners, not osteopaths, that can advocate for you and talk to your experience. So it is not an easy process, and nor should it be, because it does mean something, and it's not just it means that it's very unlikely that a practitioner just, at the minute that they're 5 years out, will get advanced practice credentialing, because there's a lot to do. There's physically a lot to do.
How
So
many
it's
how many hours a week, Bruce, would you spend on, I guess, within a sports team at the moment? You yourself, are you doing, we'll say, 3 hours, 4 hours a week with sports clubs?
yeah, yeah.
Right.
That's my minimum with Hawks, and
Yeah.
then a few athletes in clinic, and then the tennis stuff is sort of obviously
Yeah.
just for that time. Yeah.
So about 30 to 40 weeks of a year, you'd be able to get those hours under your belt. You said 120. You said about 120 hours.
That's sports specific CPD, where I've actually have to study, like, so I
Right.
do a course. So
Oh, right.
that's in addition. So
Okay. So
so
that's not time spent with
no.
teams and so forth. Right.
No, no, no,
Okay.
no,
Okay.
no.
Well, that
I've had to put money where my mouth is, and pay for Peter
yeah,
Malliaris's tendinopathy course, and
yeah.
I've done the SMA functional movement course, and so again, you know they're expensive courses. So again, it's unlikely that a practitioner 2, 3, 4 years out is
Okay.
going to be stumping up to rack up 120
Right.
hours of sports. So yeah,
Okay.
I,
And what about the? I mean, you've got that's the vocational pathway, but then you've got
yeah,
the. I think the. Geez, mind blank.
the tertiary
The
pathway,
tertiary pathway.
which is having some sort of postgraduate qualification,
Right.
which you might have previously had, in
Yeah.
phys ed, or a strength and conditioning masters, or yeah,
So
something like that.
could that then possibly see osteopaths, I guess, do that? I mean, you could do that might take a year or two to do a post grad in something. Could that then see somebody who's, I guess, 5 years out of practice do something like that, and by the 7th year be able to get their credentialing? And I guess the other question is, have you had anyone, I don't want to use the word slip through the gaps, but have you had
Mm.
anyone at the moment who's been titled that is under 5 years?
Not sure.
5 years?
Not sure, mate. No,
Right,
I
right.
couldn't. Yeah, couldn't comment. But
Okay.
yeah, we definitely do want to shore up that
Yeah.
process. That's
Yeah,
for
good.
sure. But yeah, and most postgraduate, like tertiary qualification, is generally at least a 2-year process. There's not. Yeah, so
And
yeah,
that's a pretty substantial commitment too to do a
it
postgrad. I
is,
mean, that's
and
not
and
something.
they're bloody expensive too.
Yeah, they're
Those, yeah,
expensive, and they're not just that they're tough in terms of the the study, but just the effort and energy to
Yeah.
work and study at the same time. That's a bit
Yeah.
rigorous too.
Yeah.
Yeah. All right. I want to then, I guess, go back to the town halls that you attended, and can you tell us a bit about? I mean, you mentioned some of the things you saw in terms of the using the consultancy to understand the different phases of careers of an osteopath. Were there any other was there any other communication that you remember that caught your mind and you want to talk to us about, that you were either happy about or unhappy about, or that you thought was interesting, or that you thought could be done differently, or
Yeah.
something you want to share with
Well,
us?
yeah. Well, I mean, the big discussion in the Victorian one was re-engaging students and Osteopathy Australia getting more actively engaged at the student level. So they are now going to be having a staff member that's their sole job is to liaise with the student bodies in the different universities
Yeah.
and to keep them engaged and hopefully organise the likes of you and me to pop in there and things like
Great.
that. But yeah, just to um, well, partly to advocate for Osteopathy Australia, but to also talk about the things that are available to them. So there was a big discussion around engaging students and engaging new grads and the steps taken there, and it sounded good. It
Okay.
sounded good.
Great, mate. As we speak, as we're recording this, board elections for Osteopathy Australia for the board is open at the moment. We've got some pretty good candidates that have nominated. I've reached out and I've been able to speak to 3 of them, and everyone can go on and find those episodes and listen to those. How do you personally decide who to vote for, Bruce? I mean, you may not vote. I don't know, but
Yeah, I do.
yeah.
Yeah, I love to
How
be
do you,
involved.
how do you personally decide who to vote for? From the outside, where do you see, I guess successes of that organisation, and what do you think they could be doing better? But before I get to that question, how do you decide, mate? Who to vote for?
I mean, I naturally like to look bigger picture, and think about what the skill set that a board needs. So so do they have a practitioner that's good with social media, or it's good with advocating, or it's good with research, or so I guess that would play a part. So where are the holes that needed to be filled within the board space? And is there a practitioner that's up for election that will nicely meet that need? And we see that in really exceptional companies, that each board member will have a particular expertise in a skill set, and have a balance there, and that practitioner, that expert can then perhaps lead a committee. So if they're strong in education, then they could perhaps be a part of or lead the education committee. So I mean, yeah, I like to think bigger picture in that regard, and try and find a balance of representation from around Australia as well. I think that's important.
Yeah. Have you? I guess looked at the current board. Have you looked at it? Have you looked at the candidates? And where do you see some of the gaps that I guess a candidate could fill in there?
Um, to be honest, I haven't looked yet, Sammy.
Okay,
So I
that's fine,
haven't done my study
mate.
there.
All right, so mate,
I've got some time.
yeah, have a listen to the podcast.
Yeah, I will.
And
Yeah, I
there's
haven't
some,
done my
yeah,
homework yet.
that's
Yeah.
all right. That's okay. I guess then the next question from the outside. looking in, where do you see the successes? I mean, you've talked about some of the successes of that organisation in terms of lobbying. I understand that. What do you think could be done better? Like, I mean, not everything's perfect, right? And I get that, but I guess when we when we have these discussions, things can get better. So, what do you think can be done better there?
Well, I think there can be improvements in NDIS availability for osteopaths. That seems to be a little bit of a blind spot that we're for some practitioners are being held out there.
Are you
So
doing a
we
lot of
need
that, Bruce? Is your clinic involved in a lot of that? Right,
just more patients that are self-funding,
self-managed,
yeah,
self-managed. Yeah.
self-managing, yeah. So we haven't done a lot of advocacy occasionally, but yeah, it's not a big thing in our
Mm.
clinic.
Okay.
Um, what else? Um, I, I'm, yeah, clearly I'm a fan, but they're not perfect,
Mm.
and uh, I've just, yeah, there were a couple of things that I did think of, but I can't recall them at the moment that
Was
could
there
be
anything that you
improved.
spoke about at the town hall? Was there any issues that you raised specifically?
Not personally, but I was more advocating for that, for new grads
Mm.
and for the keeping the students engaged,
Yeah.
and
Okay.
and the university. There was good representation from the university there, so
Yeah.
I found that good.
Do you notice or do you? I guess even if you don't notice it, are we in a bit of a state where there may be a Victorian or a Melbourne bubble forming around Osteopathy Australia? I mean, and that's I wouldn't I can't I mean I wouldn't say that wouldn't be something that would be impossible to happen because
Mm,
obviously osteopathy is the centre of power is in Melbourne because of the volume of practitioners. If you were take the voting members, that would be overwhelmingly from Victoria. And so, how do we make sure the organisation is fully represented nationally, and we don't get that kind of bubble forming?
mm. Yeah, I mean, I don't get to hear what happens in your
Mm.
state, really. Like,
Yeah,
I do, obviously, Osteopathy Australia's offices is in New South Wales.
yeah,
So,
it's in
I mean, we've
Chatswood.
always had we've
Yeah.
always had a perception that that's favourable to you guys.
Look,
That it's
yeah.
located there.
When I went through, when I was coming through and then graduated and I was a younger practitioner, we had in New South Wales was a bit of and I think Victoria too. I think the late 90s and early 2000s were a real boom for osteopathy because there was just these wonderful graduates coming out into the profession. There was that perfect balance of supply and demand, you know. And there was lots of supply, there was lots of demand, and we had that supply coming through, and everybody was busy, everybody was happy, the profession was growing. Socially, everybody was really engaged. We would have social nights, amongst us all, and we'd all go out,
Mm,
and so I think problems started to happen once that University of Western Sydney course closed down here,
mm,
and
mm,
then once the call came for it to close, there was another I think 4 years that went where they had to kind of finish up those students,
mm,
and then after that it just became within about 4 or 5 years after that it became really stagnant here, but we kept seeing this flourishing in Melbourne and Victoria, and we obviously just seeing not just media, but also just you look at everything online, and you hear about things that we hear about. Osteopaths now making it into the sporting clubs, and osteopaths making it into different avenues of aged care and NDIS and occupational health, and that's a good thing. It's a great thing. I always thought it was because the sheer volume of osteopaths in that state makes it unavoidable. Like, there's a bit of a groundswell there. So we don't have that here, and I would assume as an organisation, as a Osteopathy Australia, the customers of Osteopathy Australia are osteopaths, and the majority of their customers are in Melbourne. And so, they would be quite heavily focused on making sure that, at the very least, the graduates coming out of Melbourne were retained into the profession, and then also into the association. So my concern is that that organisation is heavily influenced by, and at the moment we don't have a sitting representative from New South Wales. I know Adam Nicholson is the only nominee that is from New South Wales. And I guess I would encourage my fellow Sydney-siders and New South Welshmen to get behind Adam, just because I think we just need representation. It would be absurd not to have a member from New South Wales on a board representing the largest market in the country. And so
I agree. I mean, that makes sense.
It's not a criticism. Like, it's not like somehow the association is engineering this. I'm not saying that at all. What I'm saying is that that's just the way that the cookie is crumbled, and we just need to make sure that doesn't get skewed in that fashion, because and even other states, Queensland also needs great representation. It'll be great to see what happens over in Western Australia once that course gets up and running. Adelaide, I spoke to Josh Saxton, who's also a nominee from Adelaide, and he'd like to see a course in Adelaide in South Australia. And so I guess it'll be great. We want to make sure that organisation stays truly national and representing everybody nationally. In terms of your career,
get a course in New South Wales, mate. That'd be
100%, mate. That's I've talked about that a lot, and it seems like I'm beating this issue over and over. But it would be that should be on the top. That I don't. If people want to get upset at me, especially Victorian osteopaths, that should be at the top of the list of laser focused things we must do in the immediate to near future, as hard as we can. We need to push for a course in New South Wales. It's just, can you imagine imagine we've got this kind of beautiful growing profession in Victoria. Can you imagine if we had that in New South Wales, just pushing the national profile of osteopathy up and up and up? It would just, it would do wonders. And then from there, I think it would just be a domino effect of getting courses set up in northern Queensland needs a course. I think regional New South Wales. I'd love to have a course, on the border there of New South Wales and Victoria that can supply the regional areas of those two states. And then South Australia as well. But definitely, we need to aim high in that direction. We need to think big and aim high and punch up. So, if there's anything you want to add to that.
No, that's makes sense. I do understand that things are hopefully moving in the right direction.
It's frustrating. Like it's frustrating. Look, and I'll be quite honest and frank with you, because I like having this conversation with you. The frustrating part is that when you don't know what's happening, it's hard to then plan for the future. And so we don't know. Like at the moment, they might be negotiating with 2 universities in New South Wales, but we never know about it. Yeah. And the reason that's always given is that, well, we can't divulge this information out of confidentiality. But you don't have to tell us who you're negotiating with, and you don't have to tell us specifics other than we're at stage 2 of negotiations. We had a negotiation with this university 3 months ago that fell over. Like, we want to know about the successes and the failures. Because then we can, as members, for example, you yourself and myself, as members, we can then make more educated decisions about who we elect on the board. I mean, it might get to a point where, as New South Wales members, we might say, I don't think the people that we have in that organisation are getting the job done. We need new people, and so we're going to push to do that. It might be an avenue we have to go down, because we're the members, right? We're the ones that make that decision. But unless we know that information, all we can assume is that nothing's happening. And so we just like more communication on that front. Like with the
Well,
West.
to be honest,
Yeah,
Sammy, like more people should have showed up at your town hall in New
yeah,
South Wales,
yeah, yeah. No,
and
I
ask that
agree.
question. Like,
I've asked that question before, Bruce, and that's the answer that I've gotten. You
yeah, I
know,
know, but just to keep asking the question, like turn up again and
yeah.
ask the same question, like because things advance and the answer might change. So
Yeah, I get the feeling that the answer will change if there's a change in actual something that's happening. And so the answer we're getting at the moment is that there's no answer, like nothing's happening. And so I agree with you. I think more people should show up to the town hall. But again, at the moment, osteopaths in New South Wales are a little bit kind of like they're just to themselves. I don't think it's great. I don't think it's a good position to be in. But that's just the way it is. I think we need to change that. I hope that, I mean, this is what I do here, hopefully changes that, but we need to get together and become a little bit more
yeah,
social. I think that's
yeah.
the first step too. There was something I wanted to add to that, but that's just slipped my mind, but that's fine. I want to ask you about your career, I guess, a bit more as well. And this will be the last question that I have for you. In terms of your career, mate, where are you at now? And how do you set goals, like to stay motivated and progress? At the moment, you seem like treatment-wise, you seem like you're pretty straight and narrow with what you do, and you're kind of fairly confident, and you've been doing it long enough to know that you're going to get results. But in terms of business, in terms of other things, how do you set goals and how do you stay motivated?
Yeah, it's a good question. I've definitely found it sort of in terms of the environment of the practice in this age where now a requirement to be doing things like social media and uh, advertising, Google AdWords, and I mean it's not an area that I love to do,
Yeah,
but you have to be involved. I don't love spending a lot of time on it, but so um, so I guess I'm still learning in that area.
doesn't
And
seem like it motivates you though. Like, is it something that's motivating
no, I
for
very
you?
much still love my contact with patients
Yeah.
and love my team and
Hmm.
mentoring my group. So I guess where that was going is I just want to maximize what I've got. I don't have ambitions to grow, start another clinic but we've got a nice space, and I just want all my guys to be busy and happy and getting along great, and hopefully down within a few years, I'll be able to I'll be ready to drop a day, play some golf. But I could see myself, so yeah, I'm 56. I'll probably, you know, I'll keep treating right for you know to 70 plus, I reckon. But maybe at a uh reduced days.
Yeah.
Maybe 2 3 days a week or something like that.
Less volume.
Yeah, yeah,
Yeah.
and
Mate, why haven't you put your hand up for a board position or something? I mean, maybe not Osteopathy Australia, but
mm,
accreditation council or I don't know, OBA or something like that. I mean, Have you not ever thought to go into more regulatory organisations?
Yeah, well, I guess I was involved in that. The advanced practice committee did take a fair bit of time. That was so, and I've done some other smaller stuff with Osteopathy Australia along the way. Yeah, but I've never put my hand up for the 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 main committee.
Yeah.
True. Yeah, just felt like I was very busy with my family and very busy with my clinic, and yeah, I realize I've got a number of friends that have been on that committee, and it is a massive commitment. And
We need a silver fox on there, mate.
yeah,
It's not going to be
thank you.
me. It might as well be
No,
you.
yeah, no, yeah,
All right. So it seems like the main driver for you is still clinical, from what I understand.
yeah, and
Yeah.
I still love my sports involvement as well. So
Yeah.
yeah,
Right.
no, I don't really have any ambitions to spread out from there, to be
All
honest.
right.
Whether I get involved back, as I said, I've offered as a casual basis to do some more teaching. I teach into other clinics on a casual basis. I really enjoy that. I'll continue to do that. Whether I eventually do some supervising in clinic, in the student clinic, I did that many years ago. I might do that again. Yeah.
All right. Well, you heard it here first, I guess. If any of the educators are listening and are in charge, Bruce has kindly put his hand up to do some teaching, and I think that's very sincere as well. I mean, where I'm saying it, well, I'm not joking. Bruce is somebody who's always given back, and so I commend you for that, mate. I want to thank you for joining me tonight. We've done just over 2 hours, and could probably easily do a couple, but I'm sure we'll be back again. I hope that before the next time we speak, hopefully we can meet in person and have a drink. But thank you for doing this. I really appreciate it.
Thanks so much for having me on, Sami. And again, kudos to you for providing what you are doing for the profession, interviewing some really important people. And yeah, you're advocating for the profession is to be commended.
Yeah, just a point on that. Like I said, I really appreciate like Bruce's candid nature with me. This is something I really like, and I don't know if that gets lost in some of the conversations I've had with other people. But I'm not somebody that I don't get offended by people pushing back. I don't get angry easily. It's not like that at all. And so this is why I enjoy talking to you, Bruce, because where we agree is great, where we might diverge in opinion, it's also good, because I've kind of, like, in terms of advanced practice, I've come around to obviously understanding its benefits. I still think it could be done in a way that, and I think that's happening from what you tell me tonight. You're making the progress rigorous, and you're making sure that the standards are there, which is ultimately what we want. Philosophically speaking about osteopathy, it's great that you're wanting somebody to be a great general osteopath. I think I don't ever want to lose that general osteopathic thought process, which is really what underpins a really good sports practicing osteopath anyway.
100%. Absolutely. Couldn't
Yeah.
agree more.
So that's I guess the essence of it is more so when the whole thing happened, it was like, well, what's going on here in terms of making sure that we maintain a really good level of professional, I guess, care. But anyway, thank you everybody for listening in. Bruce, thank you for joining me. Stay on the line, but to everyone else, have a good night.